Hello, I'm Walid Shouman. I'm presenting my research, which is about the trends of utilization of anti-epileptic drug therapies in Manitoba. Studies in Canada and around the world have shown an increase in the utilization of anti-epileptic drugs in general population. Both epilepsy and anti-epileptic drugs could affect the healthy pregnancies and lead to adverse neonatal outcomes. The objective was to examine the time trends of anti-epileptic drugs utilization among pregnant women in Manitoba, and for that we conducted a population-based cohort study using administrative health databases at Manitoba Center for Health Policy. Pregnancies of women living in Manitoba between 1995 and 2018 were included, and utilization was identified by ATC codes. 4 groups of pregnant women were created based on anti-epileptic drug exposures and epilepsy diagnosis. Out of more than 273,000 pregnancies identified, 0.3% had epilepsy diagnosis and were exposed to anti-epileptic drugs, 0.35% had an epilepsy diagnosis and were not exposed to anti-epileptic drugs, and 1% were exposed to anti-epileptic drugs but did not have an epilepsy diagnosis. Figure 1 shows an increase in the number of pregnancies exposed to anti-epileptic drugs during the study period. Figure 2 shows that there was no major shift in the percentage of pregnant women exposed to anti-epileptic drugs with epilepsy, but the percentage of pregnant women without epilepsy exposed to anti-epileptic drugs was increasing. In figure 3, you can see that 0.53% of women were exposed throughout their pregnancies, 0.5% were exposed only during the first trimester, 0.2% were exposed only during the second trimester, and 0.07% were exposed only during the third trimester. Figure 4 shows that clonazepam was the most commonly prescribed anti-epileptic drug throughout the study period, followed by gabapentin and carbamazepine, lamotrigine, phenytoin, and valproic acid. And in figure 5, 43.5% of the exposed pregnancies without epilepsy were in the lowest socioeconomic status, compared to 26.33% of the unexposed pregnancies without epilepsy. The prescribed anti-epileptic drugs were changing annually, and in the pie chart in figure 6, you can see that in 2018, clonazepam prescriptions constituted 41% of anti-epileptic drug prescriptions, followed by gabapentin 34%. We can conclude that no major shifts in the use of anti-epileptic drugs were observed among women with epilepsy, and concerns about the increase of use of anti-epileptic drugs driven by indications other than epilepsy require additional research and the safety of these agents and their indications to inform prescribers and policymakers.